Dr. Nynikka Palmer,
where I'm going to cover communicating with your healthcare team. I can't do it. So what I'd like to start with is that the single biggest problem in communication is the illusion that it has actually taken place. So essentially, when we learn to speak, whatever language we speak, we have this assumption that we know how to communicate as well. And that's not actually the case. And given our healthcare system, we definitely need to take communication skills into consideration. And what I'd like to go into now is in thinking about when you go into your healthcare appointment. And what I'm going to start with is kind of basic skills or things I want you all to know as patients entering the healthcare system for any healthcare issue, and also specifically to prostate cancer. And I do want to preface this that today what I'm focusing on is the patient perspective. So what you all can do when you enter into our healthcare system. And I will say that much of my research actually focuses on the things that we should be doing or changing in our healthcare system to ensure that all patients who come to us are getting the most high quality care possible for their diagnoses. And including that, and also, or with that, it also includes training providers in high quality, patient-centered, relationship-centered communication. And again, today what I'm focused on is what you all can do in preparation for engaging with your healthcare team. So first, I'd like to start with what you might consider doing before your appointment. I always like to suggest make a few lists. One is the concerns you have. What current concerns do you have? What would you like addressed in your appointment? And then also what's most important? Is there a priority issue that you really want to make sure the doctor doesn't miss during your appointment? Make a note of that. Actually say write it down and bring it with you. The other thing is to also make a note of your current medications, the name, the dosage, what is it for, and then also how do you take them? That's a great conversation to have with any of your doctors, no matter who it is, your primary care provider, urologist, radiation oncologist, et cetera, just so everyone's on the same page and that you always have this record of what's the current medication you're on. The other thing is keeping a note of your medical history, any particular medical conditions you're facing or managing, allergies, previous surgeries. And then finally, who are your other doctors? It's always great for you to have this list of who your doctors are so that you can share with whatever doctor you might be meeting with. The other thing I think is a really important piece is to ask someone to go with you to your appointment. It's always great to have a second pair of ears that can be helpful to listen in on the information that the doctor is sharing. And this becomes very poignant particularly an example of a prostate cancer diagnosis. All too often what we know and what you might hear later today is that once you hear those terms, those words, you have cancer, we did find prostate cancer, there's this thing that happens where patients get into their head. I mean, if I heard the words cancer, I would freak out too. Everyone has these moments where they pause. And then at that moment, you're no longer hearing that new information coming in, but rather kind of processing what was just said to you. And so it's always great to have someone else that you can bring with you to hear this information and hear any information doctors are providing. It can help alleviate some uneasiness or anxiety, perhaps. It can help you decipher information and remember. And they can also help you take notes, keep track of what was said so that you know the steps moving forward. The other big thing to do is make sure you bring everything you need to read, hear, and talk in your appointment. So perhaps you wear glasses and it'll be helpful to bring your glasses. Perhaps you could be hard of hearing and may require a hearing aid. So you want to make sure you have those items with you. And then more importantly, I always say that, perhaps there's a language issue. Perhaps English is not your first language. You want to make sure that you have an interpreter or at least ask for an interpreter, or perhaps have someone help communicate information as needed in your appointment. Now, once you've actually gotten to your appointment, what might you do? So in my training of providers to do relationship-centered communication, the first thing I always suggest is building rapport. And so as a patient, the first thing I always like to do, and all too often it doesn't happen, which I'm always surprised about, but just introduce yourself, because the doctor themselves may not actually ask, what name do you prefer? So share that, share what name you prefer to be called. The other thing is bring in a notebook, something to take notes with, or even perhaps bring an audio recorder, and you might want to ask permission if it's okay to record. Most doctors have no problem with you recording the appointment so you remember things later. And then finally, bringing your list that you made earlier prior to your appointment, including your concerns, medications, etc. The other thing that I suggest during the appointment is to be sure to actually share the information you have and your perspective. You are the authority on your own body. You know what's going on inside of you. You know what doesn't feel right. And so it's really important to share that. So in first, starting with your agenda, expressing what your concerns are with the doctor, so you ensure that, hey, this is your opportunity to guide the discussion. These are my concerns, doctor. I would like to talk about blah, blah, blah. And again, having that list of things that you have that you want to cover. The other thing I always suggest sharing is, what are your expectations? Think about what you really hope to get out of this appointment and share that with the doctor. That can usually be very helpful to guide the discussion and also get a better sense of if that doctor is the best doctor to help, or perhaps they can connect you with another doctor if they aren't able to help you in that way. And then finally, really sharing your experience, how these issues or concerns you're bringing up might be impacting your life. And this is a really important context to really ensure that you're getting the most appropriate care, but also getting that perspective from the doctor, because usually if they understand your perspective and what's happening, that can help guide not only the discussion, but also care moving forward. And now I want to get into some questions you might want to ask your doctor during your appointments. And these are some basic questions, and I'm happy to share these with all the attendees. So one, what test do I need? This kind of came up in Dr. Washington's talk, and we'll get into a little bit more specifics for prostate cancer. But what test do I need? What will they show? Why are they important? So asking those type of questions when you're speaking with your doctor, if those topics come up. How might it impact your life? So if you received a new diagnosis of something, asking what their perception is of how it might impact you would be important. The other thing I like to ask is, what is the best way to explain this to my family? All too often, patients aren't that sure about how they might go home and share this with their partner or their other family members or friends. How might they explain this the best way possible? The other point I want to make is, as providers in the healthcare system, all too often we're used to using medical jargon. So using these words that we hear all the time, but those aren't common words to patients that are coming in to see us. And so I always urge or encourage patients to say, hey, you said such and such word. What does that mean? I don't know what you're referring to. It's better to ask that than to move forward not knowing what they're referring to. The other thing I like to suggest, because in communicating, you want to make sure you have that open lines of communication. And so sometimes, particularly right now, given the pandemic, it can be hard to get in touch with your doctor or perhaps how you used to. And so you might want to connect with them and ask, what's the best time to reach you? What's the best way to follow up with you? Perhaps it's email, perhaps it's a phone call, perhaps it's through MyChart or some other patient portal. So let's get into a little bit more detail about what you might ask that are questions that are specific to prostate cancer. And Dr. Washington brought up this a little bit, in that one, you want to know, what kind of prostate cancer do I actually have and how aggressive is it? So what I always like to explain in prostate cancer is that all prostate cancers are not created equal. There's different types and variations of it that may be very indolent or low risk, I should say. And some that are very high risk that we want to make sure we move forward on in treatment. So you want to really get a sense of, where do you fall on that spectrum? The other thing you want to make sure the doctor explains to you is, what does your PSA mean, that blood test that you received, and the Gleason score, which comes from your biopsy results. And if you get the prostate cancer diagnosis, you want to know and ask for them, Is the cancer still inside of the prostate or has it spread outside? These are important questions as it has implications for what treatment options may be available to you. And then, as Dr. Washington also mentioned, what other tests would help in guiding your treatment option? Because there are lots of other tests that can be done to help inform you and give you more information to determine what might be the best treatment option for you moving forward. And then the other thing is asking, what other doctors should I talk to in considering treatment options? There are lots of different people that you may be communicating with, including your primary care doctor, your urologist, a radiation oncologist like Dr. Roach, a medical oncologist, as Dr. Washington mentioned earlier. There's really this range of people who might be a part of your team. And so you want to ask those questions of who might you need to speak with next. And along those lines, you want to go into a little bit more detail on treatment options. And I laid it out this way by the type of doctor, because each doctor has a different specialty. And so if surgery is an option, the urologist is definitely the best person to speak to. If radiation is also an option, you want to make sure you also speak with a radiation oncologist, as that is their specialty. And then with hormone therapy being a potential option, that's where the medical oncologist comes in, as was described earlier. And then in getting to these details of the treatment options, what are the pros and cons of each option? How might it impact my health? How much time off of work might be needed? Will I need any extra care at home? Are there long-term side effects I might need to consider? So these are all things you might want to think about if you're ever in a situation facing a prostate cancer diagnosis and considering treatment. The other thing I want to note, which will be talked about later today, is what clinical trials are available. It's really one thing I like to share with my community partners and members as we talk about being advocates in prostate cancer awareness is this idea of being at the table in discussions and not on the table as the patient. What I always hope is that we can be a part of the research discussion, whether as study participants, advisory board members, and getting involved from that perspective to have a greater impact on care. There's also lots of options in clinical trials that can help advance treatment, and it's important for our community to be represented in those studies. The other things you might want to consider is asking the doctor, well, what if the cancer comes back? That's always an option in a lot of, an option in a lot of cases, or a possibility in a lot of cases. And so you really want to ask those questions up front. And then finally, who might be a good suggestion for a second opinion? I always say it's a great idea to get a second opinion, and your doctor might actually have some suggestions on what direction to go there. And after your appointment, what I always like to consider is sharing this information that you received in your healthcare appointments with your support system. That may be your family members, perhaps a friend who's gone through this issue as well. And then certainly I'll follow up on any additional questions if you have them. For example, calling your doctor, sending a message through MyChart or another patient portal online, or email. And then certainly don't be afraid to set up a follow-up appointment if you feel like you need to sit down and talk more, for example, about treatment options. It's a lot of information that can get put on you at once. And so don't be afraid to set up another appointment to have a more in-depth discussion, to ask more questions. The last thing I want to do is, or share, is this idea of asking for help. And one great way to do this is connecting with a support group. We have a support group for African-American men in the Bay Area that has been running for almost 8 years now, and specifically for African-American men facing prostate cancer. And this has been a very poignant group and supportive group to help men through this process, and you'll hear a little bit more about that later today. Finally, I just want to wrap up to say your prostate cancer care team, it includes a lot of people. You are the leader of this team. So this would include your urologist, radiation oncologist, medical oncologist, and certainly your primary care doctor. But more importantly, don't forget your support system, your family, your friends, who can help you through this process and be that support throughout. And I'll stop there and pass it over, and happy to answer any questions once we get to that point. Thank you.